Motac was founded in 1992 with the goals to reduce tobacco use and exposure to secondhand smoke. Motac is a dynamic coalition comprised of over 50 health-related individuals, organizations, and education groups. Since Motac's creation, Motac has taken the lead in Douglas County to address tobacco-related issues through public education and community action. Motac's mission is to prevent and reduce tobacco use and the accompanying health and economic consequences in Omaha area via prevention through public policy and education.
I'm Adi Poor. I'm the director of the Douglas County Health Department. We have had a long-term relationship with Motac, and I'm really happy about the asset that we have through Motac. Two of our priorities are actually directly related to tobacco prevention. One of them, asthma. We see a high asthma rate, specifically in northeast Omaha, as it is related to the elderly population. And we know, of course, that tobacco is a trigger for asthma. We also have an interest in maternal and infant health, and we know again there, infant health specifically, tobacco plays an important role. So the more we can do in prevention of secondhand smoke, for example, in new apartment buildings and so on, and also what we can do in preventing young people to start smoking, the better off we are in this community. You know, we still have about 17% of our young people who start smoking, and that is too many. Therefore, Motac plays an important role in our community to really educate our young people, to do compliance, to make sure that we enforce the Clean Indoor Air Act as far as we can, and actually start new initiatives. We are very interested in the legislation that Motac is so active in, and are trying to be a really good partner in that endeavor.
Tobacco use is still the #1 cause of preventable death and disability in Nebraska, and causes cancer, asthma, and heart disease. In addition to the human toll, tobacco use is a huge weight on our economy, costing our state billions of dollars annually in healthcare costs and loss of productivity. As we look toward the future, we ask for your support so that we can continue to expose tobacco's harm and drive a large-scale social change that will decrease the current tobacco use rates for youths and adults.
Motac's Clean Air Committee has worked with the City of Omaha and community members like you to implement the Nebraska Clean Air Act. The committee is currently working to establish smoke-free multi-unit housing and recognizing businesses who go above and beyond to enforce the Nebraska Clean Indoor Air Act. With your help and for the health of the community, the Motac Clean Air Committee moves forward with the Tobacco-Free Parks initiative.
Tobacco-free parks are a growing trend across the United States. In July of 2012, a group of local people got together and started brainstorming about how we could make all of our parks tobacco-free as well. In August of 2012, we actually were able to present the idea to Motac. Motac has a history of fighting tobacco through community action and working with local people to make healthy changes for their community.
For over 15 years, the Metro Omaha Tobacco Action Coalition has been researching and evaluating the benefits of smoke-free housing and attitudes towards smoke-free policies. In recent years, with the help of its partners, Motac has been able to assist and identify nearly 60 living environments with smoke-free policies within the metro area. Smoke-free housing options give residents the choice to protect their health and save owners and property managers time and money. An MSR Group study shows that more than 70% of residents in Douglas County would choose non-smoking housing over a similar option that allows smoking. Motac has developed a smoke-free housing toolkit and offers free resources to help properties implement policies and fill this demand.
A year ago in May, one of my rental properties was affected by a fire that was a direct cause from smoking. While working in the yard, the tenant decided to light up a cigarette. After the yard work was complete, the cigarette was not, so he decided to flick out the cherry and place the remaining cigarette behind his ear for later. He proceeded inside the home and decided to straighten the bed when, supposedly unknowns to him, the cigarette fell out from behind his ear and landed in between the sheets where it sat and smoldered. Although the smoke detector saved their lives, it did not save my property. With over $26,000 in damage, the insurance company did not cover all of my loss, and the tenants did not have renter's insurance. The renovations took over 2 months, and several $1,000s later, out-of-pocket expenses to cover city code upgrades, I was back up and running. In the meantime, the tenants took off, nowhere to be found, and the insurance company is actively pursuing to recover their loss, as well as I am. Because of this event, all my properties have become smoke-free.